Hi folks, it's Dr. Rob Cywes. I'm the Carb Addiction Doc, and before we get into today's video, I just want to say thank you so much to folks that throw us a few dollars at our Patreon account and especially at our PayPal account. The addresses are in the show notes below, but that keeps this channel free. You can help us by subscribing to this channel and by liking the videos or even leaving a comment. And if you see some of our videos popping up on your feed, click on it for a few seconds. Thanks so much, and now to today's video. Hi folks, it's Dr. Rob Cywes. I'm the Carb Addiction Doc. Today we're doing a series of, another lecture in a series of discussions of the optimum carnivore diet. And the holy grail of the carnivore diet eventually is to get into what we call the lean mass hyperresponder phenotype. Anybody can get there, everybody can get there over time. And we're going to talk about the benefits and the problems with LMHR and how to move yourself slightly backwards from LMHR so that you are insulin sensitive and very healthy. The lean mass hyperresponder phenotype, over a long period of time on a pure high-fat carnivore diet, what happens is you lose a lot of weight, so there is a weight criteria. I typically use a BMI of under 25, typically anywhere from 21 to 24, which is a reasonable place to be. But the first criteria of lean mass hyperresponder is to have a lean mass. And if you do a DEXA scan that I'm not personally in favor of, you want to see two important things. You want to see your subcutaneous fat deposits to be lower, but more importantly, to qualify for lean mass hyperresponder status, you want to see a minimization of visceral fat, the fat around your organs, the fat in your organs. You want to see that go away. And that is a phenomenon of testosterone and insulin resistance, which we talk about in another state. It's not, the fat in your viscera is not the harmful thing. It's the pathway, the metabolic dysfunctional pathway that leads to the deposition of fat. So as part of LMHR, you want to see a low weight, lean mass, but also a significant reduction in visceral fat, irrespective of BMI. Your BMI may be in the 27, 26, 27 category, but you want to have very little visceral fat. In my opinion, you still qualify as the LM part of LMHR. The healthy or high responder numbers are regarding lipids, and this is kind of where we first talked about it. You want a high total cholesterol number. My range is 200 to 500. You want a high LDL cholesterol, but essentially big and fluffy. A pattern is more important than the absolute number, but in my range, 120 to 300 or higher. You can have cholesterols above 500. You can have LDLs above 300. We're going to caution about that. In my opinion, for the LMHR category to be there, you need a glucagon, a fasting glucagon above 35, and you need an insulin level below 6, ideally in the 3 to 4 or lower range. Okay, those are the ones that qualify for lean mass hyperresponder level. Now, they also look at two other lipid numbers, which more speak to glucose numbers. So you want to see a triglyceride count. The number that I use is below 75. Some people use below 80, below 70, but I want to see that below 75. And we want to see an HDL number above 75. Some people use a slightly lower, slightly higher number, but I use 75 because that gives me a 1-to-1 ratio, even though I'm not a ratio guy. A ratio of triglycerides to HDL, it's 1-to-1 with falling triglycerides, rising HDL, which tells me that you have become fat adapted. That's really the essence of LMHR. It is a measure of insulin sensitivity and fat adaptation, where the human body preferentially uses fat as a fuel source. The cells of the body are very sensitive to insulin, so you need very little insulin to get adequate sugar into the cells, because certain cells still need a small amount of sugar, but your flux of sugar is very low, and your daily cycle of fat utilization and fat storage is very high, that this is the dominant source of energy, and the rest is more nutrient provision. That is the ideal LMHR state, and it is the healthiest human state. And the best way to get there is on a pure carnivore diet that is well adapted. However, once you're there, you want to stay there and not cycle over too far. So there are certain measurements and certain metrics and certain ways in which we can adjust a carnivore diet to keep you in that centralized portion of the LMHR, in the middle of the bell curve, the carnivore bell curve, rather than going to the outside, which actually becomes unhealthy again. What are the unhealthy parts where you've overdone it? The first number, which most people never mention, is a high glucagon. If your glucagon's above 35, certainly above 50, when you fasted, that is problematic, because that means that glucagon is so dominant that you're breaking down your own tissues and you're in an excessive glucagon state. Cholesterol absorption is too high. Ketosis is not cycling. It's just your constant state. And while people are looking to get into ketosis, if your ketones are too high and your sugars are too low, that can also be problematic. So along those lines, I don't believe him. I'm going to read an email. Now, I know this is an anecdote. I'm going to read an email from an LMHR patient of mine to discuss this. And the ideal other person to look at is the transition from someone like Paul Saladino from 2020, when he wrote the Carnivore Code, pure fastidious carnivore, to where he is right now, advocating for high carbohydrates in the form of fruit and other things. One of the things they do at a restaurant is you go in there, you're hungry. You may know exactly what you're going to eat, but they'll often put bread on the table or chips on the table or whatever it is, or you order an appetizer that arrives before your main meal. Well, the reality is we only need to eat a portion of one entree. Ideally share it. However, you're hungry. So instead of having the bread or having the tortillas or having that drink, I tend to take one of these two guys with me. I take either a Ketone IQ or the little gel packs that can fit in a bag without, or in my pocket. I'm a guy. My wife tends to take these in her purse. And when we arrive, I'll swallow one of these and chase it with some water or chase it with an electrolyte mix. It costs me nothing in the restaurant. Yes, there's cost to this. However, it protects me until my meal arrives. And then because we put our entrees in the middle of the table and we all share, I'm not ravenous and I'm not binge eating. So this is a very, very useful hack for those of you like me that are binge eaters, just to temper that and give you an early sense of satiety after you've eaten very little. Plus, you save a hell of a lot of money if you're ordering one entree for the table instead of every person ordering an entree. So just a little hack. This is how I use Ketone IQ. So here's the email though. So this is from a patient of mine, and we have begun already to adjust her over excessive LMHR and insulin suppression. We measured that on blood work and we're making the correction. So here's the way it goes. By the way, I feel much better after adding milk and the bit higher level carbohydrates. More like my old self again. There were a few scary blood glucose numbers because blood glucose does go up a little bit to begin with, but they seem to be starting to normalize down again. And to be honest, I'm enjoying a bit of tasty carbohydrate. Who knew, now she started using some vegetables to this, who knew cherry tomatoes, peas, and sweet potatoes were a revelation? If you want to stay pure carnivore, you don't have to do that. We'll discuss the options. And I'm not gaining a bit of weight nor triggering sugar cravings. And my appetite is no longer voracious, desperate, and unslakable like I was on high-fat carnivore when insulin suppressed. Bravo, doctor. Okay, she said that. I just read it. The answer to your question at the end of your insulin suppression video was being in insulin suppression a problem. I am sure I'm preaching to the choir here. The answer for me is insulin suppression was unlivable, as you observed in my blood work, and was, measured by glucagon, dangerously catabolic. Means she was breaking down her own tissues. I wonder why the other carnivore doctors do not experience this personally or with their patients. Perhaps it's a lack of awareness because they're so fastidiously pro-carnivore, which I am too. Brilliant observation on your part, doctor. It is something that does need more visibility in multiple videos, and the solutions for sure are easy to adapt to and have helped me tremendously. If you need a poster child for this phenomenon, I am here to help. We are also focused on insulin resistance because most people are just starting out, but highlighting the flip side dangers of insulin suppression that can happen for us long-termers is also important to highlight more definitively over and over. So that is an email discussing this phenomenon in somebody who has done absolutely brilliantly well. Now, along these lines, what do we then have to do? And there are two very important things that we want to do when you are LMHR and insulin suppressed. And we can measure that. High glucagon, low insulin, rising triglycerides, rising A1C, rising uric acid, rising BUN. All of which potentially can cause harm over time. We don't know to the extent in an LMHR, but certainly they are a concern. So what are the two remedies? The two remedies, number one, are to reduce the amount of fat you're eating with every meal. We still want a high-fat meal, but you can go, for example, the ideal is in the visible picture over here, from a pasture-raised grain-finished cow to a pasture-raised cow. You'll see the difference in the amount of fat that is in every piece of meat. You can cut back on adding a ton of fat to your food. So maybe you eat the 80-20 hamburger without the bacon, without the cheese, without the butter. There's ways to reduce your fat, but also you have to be very cognizant that you don't want to overeat protein by amount, even though the fat-protein ratio gets affected. So we want to reduce fat ratio to protein, but not increase overall protein amount to stress the system. Okay? At the same time, we want to introduce a trigger for insulin in the gut. And insulin in the gut gets triggered by a hormone called GLP-1. When your liver makes sugar, you typically don't trigger an insulin response. That's opposite to what we're taught. Okay? When you infuse sugar into the bloodstream, or you convert protein to sugar in the liver and you release that sugar into the bloodstream, you don't create an insulin response. And our LMHRs, our long timers, have a low insulin response, which is part of the LMHR, which is part of the insulin suppression system. Insulin is primarily released in response to carbohydrates in the gut by triggering incretin hormones, the dominant one of which is GLP-1, which then causes the release of insulin and also suppresses glucagon. So we want insulin to go up and glucagon to actually come down. That's what we want, because a lot of people have high glucagon, low insulin. We want to reverse that ratio. And the way to do that is to introduce sugar. So the first best source of sugar, in my opinion, if you want to stay pure carnivore, is to introduce liquid milk. Preferably full cream milk, maybe raw milk, but introducing milk, because milk has glucose and galactose, does not have fructose, which triggers uric acid, but has glucose and galactose. At first, as this patient experienced, they saw a rise in blood sugar, but now it's normalizing. Okay? Because your insulin doesn't immediately respond, but slowly over time, you will readapt to that insulin response. So you start with a small amount of sugar triggering, not a massive amount. And then those dairy products might be adequate. So the example, my 4-year-old son gets a bottle of milk twice a day to trigger insulin. Or you can add in some non-animal-based carbohydrate. And there are two mechanisms you can do this. For a fat guy like me, I'm not going to do what I'm doing because I'm a carb addict. But there are ways, like this patient discussed, adding in sweet potatoes, adding in some peas or corn or carrots or squash, a source of vegetable carbohydrate that doesn't involve grain products or rice or potatoes, because those are the most dangerous ones. But adding in a small amount of starchy carbohydrate will have that effect without triggering the addiction. I'm probably never going to do that myself because I don't trust myself with those foods as a carb addict. That's an addiction problem, not a biology problem. So the other way to do this is, and something we do a lot in our family, we use ground beef or ground fish, fish cakes, that kind of thing, as a way to blend in foods. Now, in our case, we're blending in liver, we're blending in salt, we're blending in fat to enrich the carnivore experience. But the beauty about foods like ground beef, like ground fish, ground lamb, ground pork, is they become a great repository for additives. And you can begin to add in some carbohydrates. For example, you can is a purified protein starch, used a lot in my athletes. We're going to talk about them in a second, but adding in a carbohydrate blend. So if you think about one of the traditional foods in England is shepherd's pie, where they have a little bit a potato upper level with a ground beef down below. Well, instead of making that separate so you see it, you can blend that into your meat using a sweet potato, instead of eating a sweet potato by itself, blending it into your meat, or adding some form of a carbohydrate, even adding a little bit of honey or adding a bit of milk in your scrambled eggs. There are ways to include carbohydrates that do not trigger the addiction, but they will trigger a rise in insulin while you're eating, which is what you want. You don't want insulin when you're fasting, very low amounts, or between meals, but you want insulin there as meals. So you can incorporate and blend in a small amount of carbohydrate into your ground beef. And that is an excellent way to correct without falling into a tub of ice cream or a bag of Oreo cookies without getting into that trouble. You can blend in some honey, you can blend in some starch into that food that will trigger insulin without raising your blood sugar significantly. Or you can eat those products separately. You can start to introduce some strawberries or blueberries or berries. I would stay away from the Paul Saladino other fruit, but you can start to blend in those foods. That should be individualized based on your capacity to control the relationship. Some people may even do a bit of dark chocolate for that reason, but I would prefer for those carbohydrates to be exclusively part of your food system, part of the window where you're actually consuming animal products, and ideally at the beginning of, let's say, a 6 to 8 hour window, whereas your last meal should be pure carnivore, high-fat carnivore, and your early meal can have more of a blend of sugar to trigger that rise in insulin, but to get insulin levels to go down for the rest of the day. So you're restoring cycling. That's the key. Now, there's one other category that we're going to talk about, and those are our athletes. For athletes on a carnivore diet, one of the healthiest diets an athlete can be in for performance, for recovery, being a fat-adapted athlete. However, if you're an athlete and you are working out either as training or as part of your race or as part of your sport, you're working out or exercising for longer than 45 minutes to an hour. If you're going to go an hour, maybe 80 minutes, and that's your time frame, you don't need to do this, because your liver is automatically, and you'll see in the graphic here, you'll see my personal numbers. You'll see my blood sugar being in the 75 to 80 range as a flat line. Then I exercise, and toward, on a run for me, I'm not horribly fit, by about the 5 to 8 mile mark, you'll see my blood sugar rising up. And then when I hit that, it was a half marathon, when I hit that 13 mile mark, you'll see my numbers come down and come down back down to 70 very quickly, or 75 very quickly. That is a normal physiologic response that you want, okay? And that happens, I was fasted for 24 hours. That happened in ketosis, where my liver was releasing that under the influence of adrenaline and glucagon. That is a normal physiologic response. You'll never run out of sugar. You'll never run out of sugar. You'll never run out of sugar. You'll never run out of sugar, because then you're dead. Okay, it's that simple. But my red cells in my brain needed that sugar bump, especially when I started running out of fuel. That was a natural, normal response for me within the context of that run. Okay, now, if you are training for longer than 45 minutes to an hour, but substantially longer, you want to begin to add in some carbohydrate to allow that spike to happen, not just from your liver, because your liver eventually does decrease the amount of sugar. And what happens then is you don't run out of sugar, you bonk. Your brain starts to shut down systems. It's called the central governor theory. So your performance lacks. You start slowing down, you start resting more, you start the recovery process while you're still active, trying to enhance performance because you're running out of energy, or your brain perceives that. So when you are training longer than 60 to 80 minutes, the ideal substance is UCAN, which is a slow starch, and you start that at about the 30 to 45 minute time frame. Don't start it right away. You can take, if you want to, 1 pack to begin with, but typically you start that at about the 30 to 45 minutes, and every 30 to 45 minutes, you do another pack of UCAN. You can eat a small, half a banana, I would stay away from the rapid sugar spikes like the glucoses or the fructoses or these simple sugars, because they spike you too high and don't sustain this. But a trickle in of starch, packs that you can carry with you, you can continue, and then I'd stop about 30 minutes before you end that training session. So you're going into starting the sport in ketosis, you're using fat, you're using your own endogenous sugar, but then you start to supplement the release of sugar and the influence of glucagon with a small amount of sugar, which will trigger a small amount of insulin, which allows that to be a fuel source. But because glucagon levels are still high, you're still maintaining ketones and fat. So it's the best blend of energy for your body if you are training long term. So I've got cyclists, I've got distance runners who are going to train for 3 hours. They're going to go for a bike ride for 3 hours. Or you're playing a rugby match that's going to be 80 minutes on the field, but because of stoppages and things, it may be 2 hours. You're going for a long swim. You're going to swim for an hour and a half, 2 hours. Those are times when I would implement this as a strategy. And supplementing that carbohydrate allows insulin to continue to be triggered to get a little bit of sugar into your cells so that they can perform maximally, but you don't come out of ketosis. You don't drop that glucagon. If you use a rapid sugar, like a pure sugar, it will overbump insulin, it'll shut off glucagon, and then you bonk even harder. So that is a strategy for my athletes, but in order to use that strategy, you kind of want to be fat adapted, insulin sensitive before you begin to use that. Get there first as an athlete and then augment. And that's the strategy. That's the way we deal with this. Or if you are a bulk athlete, if you're a power lifter, you may want to use a high-fat diet. Keto brick is one of those where it's a very high level of fat, but also during that training and during the rest period, introduce a small amount of carbohydrate to allow the protein to primarily go to your muscles rather than be triaged to form glucose. So those are strategies, functional scientific strategies you can use to protect yourself, but you need to monitor your levels through finger sticks or a CGM. And it's so beautiful to see those traces. I am the Carb Addiction Doc. These are sophisticated elements, but they're crucial for individuals looking to optimize a carnivore diet and not to blame the diet for malfunction within.